Hi, my name is John Kheir, a cardiologist and researcher at Boston Children's Hospital. I want to tell you about a clinical trial we are doing that your child may be enrolled in. Cardiac arrest is a rare but critical situation in which the heart stops beating effectively. This is a real emergency. Even if only for a few seconds, interrupted blood flow deprives the body of oxygen and damage to organs starts immediately. We administer CPR and medications to help the heart start beating again. We sometimes have to use ECMO, a heart-lung bypass machine that rapidly restores blood flow to the body. But that procedure can last 30 minutes or longer, which lengthens the time that organs lack oxygen and potentially leads to brain damage and other poor outcomes. At Boston Children's, we're doing a clinical trial to see if treating a patient with hydrogen can limit that damage by actively treating cells that are deprived of oxygen in the moments during and immediately after cardiac arrest. This clinical trial is called HydrogenFAST. We're focused on hydrogen because in previous clinical trials, including those at Boston Children's, it has been shown to reduce cell damage, even in situations like cardiac arrest requiring ECMO. That research has led to this clinical trial in cardiac ICU patients at Boston Children's who have had a cardiac arrest that requires ECMO. Some of the patients in the trial will be randomly chosen to receive hydrogen treatment for 72 hours. Now, I'd like to stress that all patients enrolled in this trial will receive all the care we give to patients now. About 2/3 of the patients enrolled will be randomly assigned to also get hydrogen. We'll compare the results of patients who receive hydrogen with those who don't to determine whether it's an effective treatment. This trial is being overseen by the Food and Drug Administration. It's been funded by the National Institutes of Health and was approved by the Boston Children's Hospital Institutional Review Board. Because we have to start the hydrogen study quickly, we do not have time to get informed consent from families. To conduct this clinical trial, we're using a set of federal regulations, commonly known as EFIC, or Exception from Informed Consent. EFIC regulations allow research to begin before asking the patient or their family for consent. You can ask the study team to remove your child from the trial anytime, or you can remove your child from the trial ahead of time by using the link below to opt out. Now, I want to assure you, cardiac arrest and ECMO treatment rarely happen. We are committed to improving outcomes for every patient and want you to know about this trial. Please don't hesitate to contact our team. We'll provide more details and answer any questions you may have.